We have just recently actually had a inaugural meeting of PAREA. We kind of started, it was our day one, and this was on the 23rd of June. We had a online event which attracted around 250 registrations. We had really high-level speakers. We had Dr. Thomas Insel, who is a former director of the US National Institute for Mental Health. He was leading it for almost 15 years. We had representatives from the European Commission, from European Medicines Agency, from PAREA members. So we formally started working as PAREA, and on this occasion we also launched a call to action to policymakers, where we speak about a number of areas where we really need to think proactively already about these treatments. So we'll be again covering research, we'll be covering access, drug reform, how to ensure the optimal care and safety for participants. And I'd like to also add that for those of people perhaps that already read a bit about this kind of emerging field of psychedelic-assisted novel treatments, I realized that a lot of discussions for now and a lot of research is looking at mental health conditions, and they seem to be very effective. We have studies, for instance, from Johns Hopkins, or Imperial College London, and many other groups that investigate their use for, treatment-resistant depression or major depressive disorder. And it seems that the effect sizes for now are enormous. More than 50% of patients no longer have symptoms of depression, say a couple of months after treatment. So this is really impressive, and even when we apply more rigorous studies and bigger populations, even if these effect sizes are smaller, we believe that these treatments can still help a lot of people. And let us not forget here that there are massive unmet needs in the area of mental, neurological, and substance use disorders. We know that in Europe, about, I think, every 6 European is affected by a mental health condition at any point, at any given year. We know that neurological disorders are the 3rd leading cause of disability-adjusted years and a 3rd leading cause of deaths in Europe. Addictions, alcohol use disorder is very prevalent, and we all know people in our surrounding that are touched by some form of addiction. So, we are not saying that psychedelic-assisted treatments are going to help to cure mental health conditions or help everyone, but we believe that if there is a subset of population of patients that they could help, and even if it's 5%, then if you know that around, I think, 80 million Europeans are affected by mental health conditions, so even a few percent will go into millions of people that we can help. I would just like perhaps to really re-emphasize that psychedelic-assisted treatments are a combination of drugs and therapy, and what they are really good at is also that their onset, they work really almost immediately. We know that a lot of treatments, for instance, in psychiatric disorders, take a lot of time to start working. Psychedelics seem to really work fast. What they are also really interesting for, in my view, is that they are not a reactive treatment that only masks the symptoms. What they seem to do is really help people to uncover difficult experiences in their lives, like childhood traumas. And when they are in a safe and supported setting with therapists, they are able to really confront them, to in a way rewrite them, to make peace with them. They open this kind of window of neuroplasticity and change, and help people to break their patterns like ruminative thinking and kind of rigid patterns that they acquired as part of their mental health conditions. So I think it's so interesting that it's no longer just marking the symptoms, but they really seem to help people to address some core dimensions of their mental health problems.